Ecstasy, also known as MDMA, is a stimulant that is classified as a Schedule I drug, which means high potential for abuse and no medical purpose for it. Though it's a stimulant, it also acts like hallucinogenic as well. Ecstasy is often taken as a pill, but could be crushed into a powder and snorted. Effects of taking ecstasy usually occur within 30 to 60 minutes of ingesting it, and typically last for 3 to 4 hours after consumption. Effects of the drug depends on a person's weight, health, and how often they take it. MDMA was created in 1914 by Merck. It was thought it could be used as an appetite suppressant. In the 1970s, it was given to psychotherapy patients to help because doctors thought it would help improve their mood and other aspects of life. In the 1980s, it was banned in the U.S. due to studies that showed that it caused brain damage. Unfortunately, in the late 1990s and early 2000s, it became popular among teenagers and young adults. Recently, in the past 15 years, teenagers and young adults have begun to take ecstasy at parties or clubs to increase their energy to dance and party longer. But taking ecstasy combined with being in hot, crowded spaces usually leads to dehydration. Dehydration can lead to an increase in body temperature, which could lead to muscle breakdown, kidney, liver, or cardiovascular failure, which could ultimately lead to death. Many people thinking that drinking a lot of water will help them not get dehydrated, but drinking too much water while taking ecstasy is a bad combination. It could cause brain swelling and a person could go into a coma and possibly die. Ecstasy affects 3 neurotransmitters in the brain, including serotonin, dopamine, and norepinephrine. Taking ecstasy releases large amounts of serotonin from the brain. It takes a while to rebuild these serotonin levels back up. So there are many short-term effects of taking ecstasy. The most prominent effect is that it produces an intense, pleasurable feeling. It enhances a person's confidence and energy. It also causes a feeling of closeness to other people. People on ecstasy are more sociable and have an easier time getting to know other people because their anxiety levels decrease. A person's heart rate and blood pressure also tend to increase. Some other minor short-term effects include involuntary teeth clenching, fixation on lights and sounds, nausea, blurred vision, and sweating. There are many after effects of taking ecstasy as well. Feeling fatigue is one of the most common effects because of the increased energy your body has for several hours. Many people report feelings of anxiety and depression. This is a result of the brain's inability to establish normal levels of serotonin in the brain. Other after effects that occur because of a person's serotonin levels are off are lack of concentration and motivation, impaired attention, irritability, and loss of appetite. A person may also have soreness in the jaw as a result of the involuntary teeth clenching while they are on ecstasy. Insomnia is also another effect of taking ecstasy. The major long-term effect of taking ecstasy is the damage it does to the brain. Ecstasy damages the cells in the brain that produce serotonin. Serotonin controls mood, appetite, pain, learning, and memory. So when cells that produce serotonin are damaged or destroyed, a person faces problems in one or all of these areas. Most people tend to experience mood swings, loss of appetite, problems in learning new things, and inability to remember new things due to these levels in the brain. Ecstasy is a very addictive drug. The main reason it has become highly addictive is because most forms of ecstasy nowadays is mixed with a combination of other drugs. People tend to go through withdrawal usually 12 hours after consuming it, and some of the beginning symptoms of withdrawal include cravings, insomnia, difficulty concentrating, and restlessness. Some other more severe symptoms are anxiety, depression, panic attacks, and delusion. Best way for a person to overcome their addiction is to enter rehab. Following rehab, it is recommended they receive individual or group counseling to help them stay clean. Although ecstasy is a very addictive and dangerous drug, there are studies testing possible medical uses for it. There was one study that was conducted to test the possible effects of giving people with PTSD ecstasy 3 times. So far, they have found that these people have had great improvements in life. Ecstasy is also being tested with patients with terminally ill cancer. It is believed that ecstasy helps reduce pain and could help make these patients' last few weeks or months more bearable. But there is not much information about it yet due to the bad reputation ecstasy has.